America loves a good promise, especially when Washington delivers it with a straight face and a flag backdrop. Back in 2009, that promise was simple. We are going to fix healthcare, not patch it, not duct tape it, not hold it together until the next election. No, this was sold as the solution: permanent, stable, transformational. Today, in 2025, we're standing in the exact same ditch we were standing in 15 years ago. Same arguments, same panic, same millions may lose coverage headlines. Washington just keeps rebooting the same movie and hoping that none of us remember the plot. This is episode 1 of the Morning Report series, The Loop. And today, we go back to the beginning, way back to 2009, where the fine print of the Affordable Care Act quietly guaranteed the crisis that we are living through right now. Because unless you read the footnotes, the real story never shows up in the brochure. Let's begin. 2009 was one of those years where Washington smelled opportunity. The recession shook the country. People were scared about their jobs, savings, and yes, losing their health insurance coverage. And when people are scared, Congress sees daylight. President Obama stepped to the microphone with the confidence of a man sure he had the answer. He said, the Affordable Care Act will bring stability and security. He said, this will lower premiums by up to $2,500 for the typical family. He said, if you like your plan, you can keep your plan. And he also said, if you like your doctor, you can keep your doctor. All those lines got tumultuous applause. They got incredible headlines. They got votes. But the fine print, the actual engineering behind the Affordable Care Act, well, it told a much, much different story. To know where we're going, you've got to remember what they actually built. Now, a lot of people think the Affordable Care Act was just one clean idea. Make healthcare affordable. Well, not quite. The Affordable Care Act was a bargain, a political deal stitched together to get 60 Senate votes. That's why it took so long. During the only small window that Democrats had a filibuster-proof majority. Which is why when the bill came, they didn't just pass it the same day. You wonder why it was taking so long? Did you wonder why Tea Party people like me were able to go into parks and do speeches and all that stuff? Why? Because the Democrats were trying to stitch this thing together to get 60 votes. So what do? They built what we're going to call a 5-legged table. Number 1, massive subsidies. Why? To hide the true cost of premiums. 2, the individual mandate. To punish healthy people who said, nah, I'm not doing that. Three, a Medicaid expansion to sweep the lowest income Americans off the rolls. Number four, regulations that forced insurance to cover everybody, pre-existing condition, whatever. Number five, backdoor insurance bailouts to keep companies from leaving the marketplaces. This wasn't a healthcare system. It was a tower of compromises dressed up like a revolution. And none of it, not one part, was designed to function without constant federal interventions. That's the fine print. Now, the Affordable Care Act claimed it would reduce cost, expand coverage, increase competition, and stabilize the individual market. But the designers and a few of the rest of us knew something the public didn't know and refused to be told. Competition disappears when everybody has to sell the same product at the same price. Costs rise when you mandate more coverage without addressing supply. That's why car insurance in Florida is so expensive, because it's required. Markets destabilize when you require insurance to take all customers, but give them no way to price risk. Like these people over here, they're 25 and 27, married, healthy. I'm not going to charge them as much. These people over here are 70, 72. Both of them got diabetes, and both of them have heart surgeries. Reality says that those people over there cost more money. Reality says the people over here, the 27-year-old and 25-year-old, don't cost nearly as much money. That's as awful as it may sound. That's our reality. So how do they hide all these contradictions? How do they? What do they create the smokescreen with? One word: subsidies. Subsidies, not permanent ones, not structural ones that were inside the no. Not funded for a generation ones. Not like, hey, this is going to be okay for the next 35, 40, 50 years. No. Temporary subsidies, political subsidies, and expiring subsidies. Set to go away right around whenever Democrats assumed Republicans would be forced to, quote, renew them or get blamed. Okay, that's not policy. That's a booby trap with a press release. Okay, let's talk results now. The kind you can't sweep under a podium. Here's the first promise: premiums will go down. Here's what happened: premiums doubled from 2013 to 2019. Another promise: costs will come down. The reality is that out of pocket costs rose sharply. Deductibles just ballooned. There'll be more choices, was another promise. So by 2017, many counties had one single insurer, a monopoly that was created by government policy. And this is the best one: if you like your plan, you can keep your plan. Millions were sent cancellation letters, not because of greedy insurers, but because the Affordable Care Act outlawed millions of plans that didn't meet Washington's new definition of acceptable. Here's the truth that no senator, no legacy media outlet, and no White House communications intern wants to say out loud. The Affordable Care Act cannot function without subsidies. After these subsidies, and those subsidies were never permanent. Again, the Affordable Care Act cannot function without subsidies. And those subsidies were never permanent. Now, the Affordable Care Act marketplace looks stable only when the federal government pours billions of taxpayer dollars underneath it. Like a table that needs a new stack of books every year just to stay level. And here's the key. Democrats wrote the expiration dates. Democrats extended them. Democrats set the final cutoff for December 31st, 2025. In a few days, really. Not Republicans, not MAGA extremists, not a parliamentary accident. It's in the statute. Signed, dated, scheduled. Like a time bomb, they planted and then they forgot to defuse. All right, fast forward to 2021. Democrats had the White House. They had the House of Representatives. They had the Senate. If they believed that the Affordable Care Act was stable enough to stand on its own, they could have removed the subsidies entirely. If they believed that the subsidies were essential, they could have made them permanent. No one could have stopped them. They didn't do either of those things. Instead, they increased the subsidies. They expanded the eligibility. They extended them only to the end of 2025. What they did was lock in another cliff. And this one, even bigger. And now, 3.8 million Americans face losing coverage or being priced out of the market the moment those subsidies expire. Not because Republicans cut them, but because Democrats scheduled the expiration. This is a dirty little secret of the Affordable Care Act. And that's what brings us to now. Look around. The headlines today are the same as the headlines in 2009. Millions could lose coverage. The insurers warn of instability. Congress must act. Deja vu doesn't even cover it. This is just a reboot. We were told that the Affordable Care Act fixed the system. We were told it created stability. We were told that the crisis was behind us. But here we are, right back at the same argument. 15 years older, with more debt, fewer insurers, and a public even more exhausted by Washington games. The loop is real. And it's repeating. And it's not accidental. This isn't just about healthcare. It's about honesty. It's about accountability. It's about whether Washington can ever fix something without setting a timer to break it later. This episode, well, it's the foundation. It's the history they rewrite every time they get nervous. It's the truth the public needs before we can even talk about the next step. Because in the next episode, we're going to dive into the engine of the entire system, the subsidy machine, and why nothing in the Affordable Care Act works without it. And in the third episode, it hits the big bomb. Why did Democrats choose December 31st, 2025? And how they set up today's shutdowns fight on purpose. This is the Morning Report. My name is Willie Lawson. This is the truth, not the press release. This is episode 1 of The Loop. Until we see you again, go out there and learn something, love somebody, and for goodness sakes, y'all take care of yourself. We will see you when we see you. Bye-bye now.